there's a lot more politics in healthcare than there should be. If I had to say any one phrase to put it, that's what I'll say. There's a lot more politics in healthcare than it should be.
What's up, y'all? My name is Alan Sheriff, aka Alan the Sheriff of All Things Innovative, and this is the ATS Podcast. Here on the ATS Podcast, we talk about all things science, technology, and psychology related, and it's my hope that I'm making the world a better place, one new episode at a time. Let's get into it. So today we're going to be talking about the future of healthcare, and we have a special guest with us today. Her name is Senan Moore. She is a physician assistant, and she not only hosts her own podcast, Healthcare Boulevard, but she helps provide young individuals information on how to navigate the healthcare field. So everybody, please join me in welcoming this very special guest today, Senan Moore. How are you doing today?
I am well, thank you. How you doing?
I'm good. I actually can't wait to get into the subject because I have a lot of questions, especially with my own personal experiences. Like I've had some terrible experiences, so I actually can't wait to get into it. Excited. All right, so let's go ahead and do this. So right off the bat, let me go ahead and share a quick story with you, just because I'm really eager. I went to Delaware not too long ago. It was like a short trip that I took with my mom. And long story short, I ended up having an allergic reaction to like one of my family members' foods. So I ended up going to one of their nearby hospitals, and my allergic reaction had went down by the time I got there. But as soon as, I was waiting in the emergency room for a little while and they gave me a few pills, I thought my health care insurance was going to take care of it. But unfortunately, it didn't, and on top of that, I had to pay $300 just to get pills. And the only thing that's going through my head is like, what the heck? Like, all I did was take some pills. So it's like my mind has just been going through it, trying to figure out why the healthcare system is like this. And, hopefully you can shed a little bit of light on it today. Just a little funny story I wanted to share because it's been driving me crazy. So basically, what do you think are some of the, right off the bat, what do you think are some of the fundamental issues with the U.S. healthcare system, and what might we be able to do to improve it?
Oh my gosh, I could see that's a whole like one full day episode, right?
Yeah. I was sorry for making it too broad. I'm naive in that way.
You're fine. And it's funny because if you ask any healthcare professionals, and that from doctors to have a PA, and we'll have nurses and so forth, there are some commonalities in the response that will give you, and there are some differences. One of the main thing is for us as providers, whether it's a PA, NP, or MD, a lot of time we have to not only learn medicine and practice medicine, but we also have to know like the law, the politics of insurance, right?
Okay.
And most of us don't like it. We don't like it because a lot of time we want to get in there, treat the patient, diagnose them, send them up to where they need to be if they need to go to a specialist, and be good. But then oftentimes you have to pay attention to what insurance do they have? Will the insurance cover this medication or will it not? If they don't have insurance, then you have to sort of like be systematic about what you can or cannot do, what the patient is able to afford and what they cannot. If the insurance is a PPO versus an HMO, and it's like a whole thing.
Oh man.
So that's one thing, right? Dealing with insurance or lack of insurance, dealing with regulations that may or may not really benefit the patient or us as providers as we're trying to treat the patient. One thing for sure that we know, let me sort of give you a story to piggyback the story you just gave me, right?
Yeah, sure.
And this just happened yesterday. One of the patients I saw yesterday, and I was doing a lot of virtual visits yesterday, and one of them came in. I saw her. She was like, "Oh, I'm having some I think I have COVID screening," to sort of me telling her, okay, should she get tested or should she not get tested? And I'm like, well, right off the bat, that's not even the problem I'm going to address because I'm going to send you to the ER. The reason is, she's like, oh, I'm having a bit of a discomfort on my chest, and my breathing is not too well. And this patient have history of diabetic. She's a little older. So, all that combined, I'm like, if you are an 18-year-old, maybe I'm not going to be sending you to the ER right away. But with your history and with your age and the way I'm looking at you, she's barely able to sit up. I'm like, you have to go to the ER. I'm not even going to, the ER is going to deal with you and help you out regardless of your COVID status, right?
Mm-hmm.
I can't even ask you to come into the office because I don't know your COVID status, and that's the policy for our clinic. And the funny thing is, not the funny thing, but the devastating part is, she's like, well, the hospital that takes my insurance is over an hour away. And I'm like, well, you know what? You don't worry about the insurance. Go to the ER, right? The ER is going to help you. And the thing is, I have to spend more time convincing her to go to the ER because she was so worried about the cost.
Yes.
That is going to, the cost she's had to pay out of pocket because her insurance doesn't cover certain things, and her being essentially being punished for getting immediate care as she needed. Yeah. So most of the time I spend is like, I'm gonna talk you into going to the ER. I shouldn't have to, but I'm gonna have to because you are worried about the cost, as you should. But you know, that's an example of patients themselves are suffering from the bad system we have, right? Because they have to think twice about, I need care, but can I get it? Should I get it? Should I go into it? And you end up with some people the disease getting to stages that it shouldn't, because they just waiting. And it's a lot. It's a lot with there's a lot more politics in healthcare than there should be. If I had to say any one phrase to put it, that's what I'll say. There's a lot more politics in healthcare than it should be, and that's really bringing us down to the point where, you know, we are one of the least productive healthcare system, and yet we are the one where healthcare system costs so much. So we are putting a lot of money into it. Where it's going, nobody knows, because it's definitely not giving us the result that it should. Wow. You know. Wow. I can't hear you, by the way.
Oh, you can't?
Oh, no, we're good. Okay. Yeah. So that's one of the biggest thing, and healthcare providers have had it up to here. Patients have had it up to here, and something got to change.
Yeah, I mean, I just hear that dynamic, and it drives me nuts. The fact that we as patients have to fear so much is just going to get the care that we need. Just because of the cost. Like the fact that we're, you know, the most richest, you know, nation in the globe, and our healthcare system is like this, and we're reacting this way as patients is not good. But to hear how other patients react to their healthcare system in their countries, like all over the world, is just, it makes you think, well, what is it that we're doing so wrong? You know, and when you say politics, I'm thinking, okay, so is it like a government type of thing? I mean, isn't the government supposed to have some type of role, some type of responsibility when stepping in to kind of take the helm on the issue of this matter? I mean, what exactly can they, in your personal opinion, what do you feel like they can sort of direct more of their attention towards when it comes to solving this issue? Is it focusing on the humanity? Is it focusing on the economics? Is it focusing on, like, what's your kind of personal opinion on that?
I think one thing is that there's a lot of laissez-faire when it comes to insurances and what they can or cannot cover and what they can choose to do and not do. And in that aspect, every insurance, it's a company, it's a business, and I totally understand that business. It's got to run, you got to make income and so forth. But at the same time, when there's no regulation, nobody regulating any of these insurances and what they should be able to pay for and what they shouldn't, there should be more of like a minimum. If you're on insurance, there should be a minimum set of things that you have to pay for, regardless of what setting it is. Or if a patient needs immediate care, you should be able to cover that regardless of where they get the care and why they got the care. You know what I mean? We've had people just have to, you can give them this medication, even though it's the best one for the condition, given their risk factors and everything. And we've had providers have to fight insurances to get the patients the medications they need, or the procedures they need. So on the Medicare or Medicare is supposed to be like the government's response to that. But number one, there are some folks who need it, who do not, who are like maybe a few dollars above what they need to be making, the maximum they need to be making to qualify for Medicaid or Medicare. No, specifically Medicaid. And so that makes it hard because, well, you're like, okay, I'm too rich to get Medicaid, but once you bring down my bills and everything that I'm paying for, I barely have the money to pay for insurance, right? And the insurance I'm paying for, if I do end up getting insurance, it's too expensive. It's not covering a lot of the things I need. I had to still pay a lot out of pocket. And thus you end up with a lot of people who don't have insurance because they're like, well, I can't afford it. It's between paying for something that I need to use, I may need to use once or twice a year, or paying or putting food on the table, you know. And I don't know if there's a minimum, there should be like a cap on how much insurance can ask for. You know what I mean?
Yes, exactly.
Especially for everyday Americans. Like, I know the if you want to have different insurance companies for the rich and the 1%ers, that makes a lot of sense. They can get a specialized, glycinized with all the sprinkle on it insurance, and pay for it, you know. But for those who are just everyday American working to pay for the insurance, there should be like some type of cap on, okay, you shouldn't charge more than this every month for these services, you know, for this coverage. But we don't have that. Everybody makes their own rule. And even the Medicaid itself, which is the government insurance, has a lot of limitations because they're making sure that they're not paying for anything that's more than the basic. You know, a lot of time that's what it is. If you prescribe anything that's not the used to antibiotic or the used to medication, they'll be like, well, why did you give that? We usually pay for this because it's cheaper. That is one thing I learned in school that was devastating for a lot of us, is we find ourselves asking our teachers and professors at the time, well, why is this medication the first line medication, right? Exactly. When the other ones in the same class, how do you determine the first one line medications? And a lot of time it's because of cost. Not necessarily because of it's the best treatment for the disease. It's usually, okay, it works for the disease, but really it's because of cost. So you end up in that situation where if the medication that is the cheapest for the disease doesn't work, or the patient is having reaction to it, you have to fight off the insurance, whether it's Medicaid or private insurance, to get the other medications that are more expensive but will work better for the patient. So it's a headache.
But you see, that's what makes it so frustrating, right? Because it's like you're ignoring someone's humanity. Because if you think about it long term, and I know it's hard for some people to consider it this way, but when you think about it long term, when you think about the fact that you could provide much better medicines, you know, to individuals, and that will in turn obviously help them with their health, they can be more productive. They can go out, they can work more, they can achieve more, they can do more for companies. It can help raise, profits for whomever or whatever it is. But, when we're looking at it from the outset and all we're focusing on is cost and, this is just if it's not doing anything for the patient and it's cheap, then what's the point? Like, where's the real trade-off? And, it's kind of taking away the humanity from it, which is like frustrating to me because it's like, well, what the heck? Like, we're just going in circles at this point. Like, it's just, that one cog in the machine that's causing everything else to malfunction. So it's insane. It's insane. Like, it's really unfair when I think about it sometimes. And for me, I tend to focus a lot more on like the humility of things, the humanity of things. I feel like we need to become more, more human centric, more, humane focused in a way, so we can try to figure out ways in which we can. And I know it's complicated. I know it's extremely complicated, but we definitely need to find ways to look more forward and long term in terms of helping human beings and just helping us all, get better healthcare in this world. So yeah, I definitely understand. So how do you think COVID has affected our healthcare system? Do you feel like it's impacted it in like an extremely insane way, or do you feel like this has just helped us kind of, maybe it's annoyed us a bit, but it's kind of helped reshift our focus?
I think it should change it more than it will, essentially. And what I mean by that is there's a lot of lessons to have to be learned from what we're dealing with. that we thought was just going to be a couple months, right? Back in 2020, it's like, okay, all right, we'll be ready and be done with the COVID-19 by June, and we'll all be on the beach, like, oh yeah. But look at us. It's 20, it's 2022, and we're still here.
Yeah,
Like,
we
you know,
still here. We still going through
we're,
it. I'm
we are
still
still
eating.
here.
I'm
We
still eating beef patties in my apartment. Like,
and COVID is just putting out albums after album, like encores. Like, come on now, y'all. No, this concert is not ending anytime soon. Let's go. COVID came strong. And here's the
yeah.
thing:
Mm-hmm.
there is a lot we could learn from it. But I think knowing us, knowing how we behave, and the things that we put in priority, I
Mm-hmm.
think once this COVID finally either ends, or we start to agree that it's just gonna be part of our normal life.
Mm-hmm.
I think once all of that is done, we're gonna go back to who we were.
Mm.
And that's just the hard truth. I think it should. I think we could learn a lot from this, in terms of there have been some changes in terms of protocol. A lot have improved. We've been able to sort of, in terms of, let's say, virtual visits, for example. That
Mm-hmm.
was not as common before COVID, but we've come to a point where we're like, okay, we can do a lot virtually. And
Mm-hmm.
that's good
Mm-hmm.
or bad depending on the setting, right? Like treating a URI, or like somebody having cold symptoms or whatever, or even a UTI. Some of those things that are not complicated can easily be done virtually. But of course, you don't want to get to a point where everybody wants to be virtual, and then you don't have the space and setting where you're able to differentiate the condition you can treat virtually,
Mm-hmm.
and the
Mm-hmm.
conditions that, okay, come in, let me see you, let me look in the back of your throat, let me touch your body, let me
Mm-hmm.
see this rash, is it raising, is it doing this? When we are going to be able to differentiate what which conditions and which symptoms and which signs of patients we can just treat, and have them come back and be like, okay, if it's not working out, if the treatment I give you after my virtual visit is not working out, let's do an in-person visit and let me see if there's something I'm missing,
Mm-hmm.
versus being able to right off the bat come in and I need to see you. So I think that would definitely sort of, I want to say, better our efficiency,
Mm-hmm.
not just for providers, but especially for patients, because we have a lot of time. A lot of Americans are hardworking, right? They're working 9 to 5, and a lot of time, most of their clinics are also open 9 to 5.
Mm-hmm.
Especially provided. We have people already having to wait like 3 months to see their provider. So if they're doing virtual, I would hope that would decrease that time period between, okay, I need care, but I can't get an appointment. I will hope, because a virtual visit is quicker,
Mm-hmm.
it's more convenient for both parties, and if you need a treatment plan right away, your doctor can see you, talk to you, see what's happening, and get that done. So I think that is one of the best things that came out of it, is that a lot of clinics and hospitals and stuff were able to implement that because they had to, and now they'll I think they will continue to do that for the visits that it's warranted for,
Mm-hmm.
and that will help both parties. um I do think that we'll go back to, for the most part, we'll go back to exactly what we were doing before the COVID, before the pandemic. I really think
Hopefully.
so. I
Hopefully.
And that's just knowing human nature and knowing us as American. I
Mm-hmm.
I I just I don't see us making too big of a change. We've been talking about climate change coming down on all of us for however many years, and we haven't really done much about it, even though
Mm-hmm.
science keeps proving over and over again that we are getting closer and closer to the dangers of it, and we're already seeing people across the world and even here dealing with it, and yet there is really isn't much we are doing about it. And so seeing all of that, all the major issues that we can do something about, that we're not doing anything about, even when we are seeing the repercussions of our lack of action,
Mm-hmm.
I'm like, why would COVID be any different?
Exactly.
You
Exactly.
know?
Yeah. I mean, there's some people out there who still believe that, they've still been living their best lives during the pandemic. So for those people, I don't even know if they feel like much has changed. They're just like, forget the vaccine, I'm going to the beach, man. Forget the mask, you know what I mean? I'm gonna live my best life. And I'm just like, come on, man, people are dying out here. Like,
Exactly. And
relax,
how
like,
and that's
relax.
the thing. Talk about politics, right? Talk
Mm,
about places where politics have should not have much space, and yet it's become the
facts,
main thing.
facts.
Like I don't get it.
Yeah,
And
facts, facts.
it's like this shouldn't be, oh, I believe in this, or I'm part of this party or
Exactly,
that party. This is not that. That's not the problem here. That
exactly.
shouldn't be the problem. And yet it is. And so I'm like, why is that gonna change? It's not gonna change. And that might be a cynic tone
Mm-hmm.
to
Yeah.
a cynic answer, but I'm I'm
Eh,
only so I need a reason to be optimistic, because I feel
uh-huh.
like empty
Yeah. Yeah.
empty optimism is like wasted. So
Mm-hmm.
I'm just like I'm like, I hope we change some stuff, but I don't believe we will.
I look, you're justified. I don't even have much to complain. Like, I don't even have too much to say, but like it's just like I'm at the point where it's just like I'm the type of person where, okay, I'm not going to force you to get vaccinated, but if you're at least taking certain precautions that'll help everyone around you remain safe, such as wearing a mask at least, you know what I mean? And maybe we could think of some other things, but if you're at least
Mm-hmm.
wearing a mask, all right, bet. But some people were just like, I don't even want to wear a mask. And I'm just like, okay, man, somebody's got to lock you somewhere.
But here's the thing: some people, you have people who still don't believe that COVID is a real thing. Who just don't believe that. It's just they're like, no, that was just a hoax. That was, there's just something they're doing to control us or whatever. And I'm like,
Mhm.
well, clearly you're not being controlled, because you're still out here having your own outrageous beliefs. So it's nothing. It's clearly
Exactly.
not working. If that was the case.
Exactly.
Um.
Exactly.
So I mean, it's I feel like to some degree in any society, and every society, regardless of the subject, there will always be people who are not on board.
Mhm.
But I feel like to have this many people, and it's like it seems like a very big part of the population. That's what it is, because I'm like, yeah, a couple people here and there, that's almost that's expected. Nobody, no society, no community thinks the same ever
Mhm.
on any subject, because we are
Exactly.
human. That's part of our beauty. It's both. It's a curse and a blessing. But to have such a big part of the population being like, I don't trust that. I don't trust that. And
Mhm.
to have healthcare providers, because we do have some healthcare providers who are part of the non-believer of COVID, and non-believer of vaccine, and non-believer of wearing PPE, which I'm like, maybe wrong profession,
Mhm.
but
Mhm.
listen,
Yeah. Okay. Yeah.
listen, let me stop talking before people come for me,
Oh
okay?
no, you're good. You're good. This is a safe space.
let me
So
let me stop talking before
no,
people
you're
come
good.
for
Yeah, there, and what makes it worse is sometimes, there are going to be instigators who come in, and try and use this to their advantage. I mean, I don't even have to start talking to you about how, how in the African community sometimes you got various actors, who try to pose as healthcare experts sometimes, but they're usually trying to push an agenda. So it just, and so
me.
I understand the history behind it sometimes, with Bill Gates and the vaccination. I understand all that sometimes, but at the same time, it's like this is a serious issue. Like we all need to get on like each other's cases about this. Like this is real. So it's like we need to do what we can now to make sure that we can all remain safe in the future. So yeah, that's extremely important. I try my best to understand all sides of the issue, but look, at the end of the day, if you're not wearing a mask, man, we got to put you somewhere. Like I just because at this point you're slowing us down. You're slowing us down. Um,
Yeah, yeah.
but yeah, yeah. Senan, thanks so much for coming on the podcast. Where can people find you?
Well, I'm on most social media, but the ones I use most is LinkedIn and IG. So if you go both on both platform, well, on LinkedIn I'm Senan Kakpo-Moore, so you'll find me there. I also have a LinkedIn page for my podcast Healthcare Boulevard, which if if you get a chance, go ahead and listen to it. And I'm very open to discussing anything on healthcare, especially career, because that's what I decided to make more of my influence is just helping people get into healthcare. It can be such a big problem trying to navigate what should I become, because there's so many options. And one of the great thing about that option is you have it, but it can also be a burden to sort of think about between all of these options, which one will be a better fit for me. So helping you, guiding you to navigate that, because I had to do that myself, and that was a tough that was a lot of work. But yeah, you can find me on IG at Senan KM or LinkedIn is Senan Kakpo-Moore.
Wonderful, wonderful. And yeah, everybody, please check out the Healthcare Boulevard podcast. It is wonderful. It is awesome. I'm definitely about to check it out again, given the fact that I let my CNA and GNA certificates expire. So, I'm trying to get back into the game. You know what I'm saying? You know what I'm saying? Thank you so much for being on the podcast. Thank you. I can't thank you enough. In all honesty, I really enjoyed this conversation. It was really mind-opening for me. Appreciate it. Hopefully, I can have you back on. And yeah, keep doing your thing. Keep doing your thing.
Thank you. And thank you for inviting me. I appreciate it. And I appreciate what you're doing with this one. Just going into and see what's happening in the world. Let's see what we can do about it, if anything, And nowadays we are at a point where we need more solutions than problems, because we already have 99 problems, And COVID is just one of them.
Yeah. Oh, man. Miss Senan Moore, thank you so much for being on the podcast.
Thank you, and have a beautiful weekend.